Okay, good afternoon, everyone. Today, I'm excited to have Dr. Chris Lawrence with us, and she, over the past handful of years, has really dove into the issue of trauma and has really trained herself on how to deal with her patients and clients that have dealt with these issues, and we're going to talk about that a little bit today. So thanks for joining me.
Myself too. Yeah. Right.
Probably a majority of us, honestly.
Right.
Yeah. So, Dr. Lawrence, can you tell us, just give us a brief overview of what you're doing right now?
Sure. So I am the co-owner of a private practice. And so I have about 20 clinicians who see all varieties of clients. So I do a lot of oversight and supervision with them. And then I'm also the director of Heartspace Clinic, which is a nonprofit in Colombia. I created that nonprofit about 5 years ago because I really wanted to have a way to bring the idea that trauma and stress is more than just cognitive, that it's really a body issue. And I wanted to be able to educate and teach about that without having to rely on people being able to pay. And so I'm doing it through a nonprofit, and if people want me to come and pay, that's great, but we have funds to be able to do that, so that we can do some education in the community without the expectation that we get paid, because I just think this information is so important to get out.
That is great. So to start off with, this is going to be difficult for us to have such a conversation about trauma in a little bit of time, but we're going to do the best we can here. So some of our folks watching know about traumas. Some of them have never heard about it except for like the Webster's dictionary definition. So how would you define trauma to someone?
So trauma is anything that causes you to be overwhelmed that you don't feel like you've recovered from. So two people can experience the same event, and one person can perhaps go through that event and have a support person there who talks them through it and holds them while they cry, and it doesn't feel like it's traumatic. They move through it and then they settle. And another person might go through it but be totally alone. And we have to finish the stress response cycle when something happens. And there are certain things that are necessary to finish the stress response cycle. So if that doesn't happen, then it can be kind of held in the body and feel like it's overwhelming because it's not finished. So it really depends on the person, but it can be one thing or it can be cumulative things.
That's what I was going to say. Correct me if I'm wrong. I remember like when I was going through school, trauma was more of like acts of war,
right?
Witnessing a murder, rape, something very traumatic like that. But now I think that we're recategorizing it because of that moving through what you were talking about, the experience and and healing from it.
Right. And age makes a big difference. Something that a 3-year-old goes through would be traumatic because they can't cognitively understand it. Whereas a 10-year-old would go through it and they can cognitively understand it, so they can get to the point of, oh, I'm okay, that thing is over, whereas a 3-year-old might not. And we also know that there are things in prenatal and birth that can be really overwhelming for a baby's or a fetus's nervous system. And that can actually be traumatic for the baby's nervous system. And the cool thing about that is that can be addressed really early on. So babies who are colicky or have difficulty sleeping or difficulty being settled, what I'll always ask is, what was the birth like? And 9 times out of 10, oh, it was really, really, really hard. Well, let's talk about that and help you and this baby get to the point of, oh, the birth is over, we're safe, we're okay. And that can be very easy to do with a baby because they don't have all these other behaviors on top of it. Yeah.
Right. That's very interesting. So let's talk a little bit about COVID hit. and we've been isolated and we haven't been getting out. Have you seen like folks who might have underlying trauma that hasn't come forward yet? Have you maybe seen more of that come forward because of this?
Yeah. So, people who've been through difficult events oftentimes have these management strategies that help them to get through life. But then sometimes there's the one thing that's like the straw that broke the camel's back. And the issue with COVID is that it meets all the definitions of trauma. It's unrelenting. We don't know when it's going to be over. It's unpredictable, and it's out of our control. And the other piece is it separates us from our loved ones. So that's like the worst case scenario, essentially, is to have something that's got those four qualities and it keeps you away from your loved ones. So the way I look at it is we're all going through traumatic stress right now, and it's affecting some people more than others, but it is affecting everybody on some level, because all of our coping strategies are not workable right now, with the exception of being outside. Some of us can't go to the gym, we can't go visit our family, like all of those strategies that are really helpful are off limits. And I think that's why you see people just kind of doing it anyway, because they're desperate, right? Like it's like, I feel like I'm gonna go crazy if I don't get to have some socialization time, or get to hang out with my friends or whatever. So it's a really difficult situation right now.
Yeah. So would you say then to folks who might be struggling, find a way to, and now it's getting to the point that it's cold and getting outside, try and find the best you can do to find other coping mechanisms to help out with this?
Well, the number one thing that I say to people is get off of news. If you can limit the amount of news that you see, most of us are going about our daily life in a pretty okay way. We've adjusted, we're working from home or whatever. So if you don't see the catastrophizing on TV, then you're probably going to go from day to day being okay. So shut off the news, because that's really making it worse. Your body doesn't know the difference between going through something awful and hearing about it. So when you hear about, at this hospital, there's this overwhelming number of people, your body kind of gets activated when it hears that, even though it's not happening. So don't hear it. It's not affecting you right now. And then other things is, yes, so connect to people the best that you can, spend time outside, even if it's cold, wrap up and go for a 10-minute walk. Change your environment a little bit. There are, there's some tools that are kind of helpful and can be helpful in terms of building resilience to stress. And some of them are things like finding something that's pleasant. So it might be a pillow on your lap, and just having that pillow on your lap and just notice how that's pleasant in your body. And a lot of times that'll just help your body to just kind of, I call it a nervous system reset. It sort of helps your body to just kind of drop. And that's a really important thing to do every day, multiple times a day, because that's turning off the sympathetic part of your brain or nervous system and turning on the parasympathetic. And we could talk, we could do another one just talking about those tricks and strategies, but yeah.
Okay, well, we might have to do that. And I think folks, those would be really easy goals to set, and especially set a reminder on your phone and
yes,
3 or 4 times a day. Just make sure you do that.
Right. When I do talks, I say set your phone 3 times a day, and when your phone goes off, turn it off, and then either just look around your room and find something that's pleasant. So it can be a picture of a pet or a plant that you particularly like, and just look at it and shut your brain off. Or take something on your lap. People like weighted blankets, and then just feel your system just kind of settle, and do that for about 60 seconds. And then go about your day.
I really like that, because so many of the Zoom meetings I've been on lately, they've been talking about self-care, because everybody is working at home, and we're almost working more because we're so accessible now. And so I think that would be great for everyone to just take those 3 times a day and
Yeah.
decompress a little bit.
Yeah. Yeah. Because for a lot of us, it used to be we would come home at the end of the day and do that kind of like, I'm home. But if you're working from home, that never happens. So it's kind of important to implement it in your day and keep that reminder there.
So we have folks that follow us from out of state, but we have a lot here in Missouri and specifically in central Missouri. So do you want to talk just a little bit more about Heartspace?
Sure. Yeah. So we have funding through the Boone County Children's Services Fund. And unfortunately, that applies just to people who live in Boone County. But I'll talk about that first, and then I'll talk about other ways to access that. But we have a couple of interventions. One is called the Safe and Sound Protocol, and the other is called HeartMath. HeartMath is a biofeedback program that teaches you how to impact your heart rate variability. And heart rate variability is connected to health and wellness. So it's a really cool, you get a device and it hooks up to your phone and you can learn these tricks to kind of settle your nervous system. And the Safe and Sound Protocol is actually an auditory intervention for hypervigilance, which most of us are hypervigilant. It just means we're kind of like this. And it actually, our hearing changes when we're hypervigilant so that we're listening more for signs of danger, because hypervigilance is basically just looking to see if there's danger around. And the Safe and Sound Protocol has been developed, and it changes that tendency for your hearing to listen for sounds of danger. And it's a really good tool to help. It works really well with kids who are activated or acting out, and it helps adults with settling their nervous system. It helps with anxiety. We do a pretty thorough trauma intake before we do it, because we have to be careful about, we try not to do it with people who don't have some kind of support. And then the other thing that we have is for anybody who works in the medical, mental health, or educational field, we offer free nervous system regulation sessions. So it's teaching those tools that I just talked about one-on-one, and there are ways in which to help settle your body. Very, very easy. And we practice them with them. And so anybody in those fields get those for free. And then we have sliding scale and other funds if people are interested in those services, but they're not from Boone County. Sometimes we can use insurance for some of them, but really different kinds of interventions than when you would get in a normal mental health setting, because they're based very much on the body and not on necessarily talk therapy.
Okay, that's perfect information. And for the folks watching, I will drop the flyer for Heartspace in the chat when we are done. So with that being said, if you could leave one piece of advice with our folks who are watching during this time that we're living in, what would it be?
Can I give two?
Sure.
So one is turn off the news, don't have it going. And two is when you would be listening to the news, grab a blanket or a pillow, put it on your lap, and notice why you like it. Notice what your body does that tells you, ooh, I really like having that weight on me. And the more you pay attention to that feeling, it'll sink in a little bit more. And it'll sometimes people will say, I feel sleepy after they do that. It's like, yeah, because your system just settled very nicely. Those would be my two pieces of advice.
Great. Perfect advice. And we'll talk soon, because maybe we can have you on again to do another one. Well, thank you so much for joining me today. I appreciate it. It was good to see your face. I miss you.
Yeah.
So take care.
It's good to see you too. All right. Okay. Bye.
Bye.